Help needed for private ambulance companies in the city of Milwaukee struggling to meet an ever-increasing call load.
The Milwaukee Fire Department now working with those companies to help them staff ambulances and continue answering 911 calls.
The need is imminent as one private company is ending its agreement with the city this fall. The I-Team's SHAUN Gallagher explains.
The pool of EMT candidates has been shrinking and more agencies are drawing those candidates into other jobs. But a list of proposals MFD is bringing to the Common Council hopes to make those private ambulance companies more attractive to healthcare workers, opening a pipeline of potential candidates for years to come. When Midwest Medical, the new owners of Paratech Ambulance, exits the city's 911 agreement, the remaining two private ambulance companies won't be able to handle those calls with the staff they have now. Fewer ambulances could eventually mean longer wait times when you call 911. In the city of Milwaukee, private ambulance companies handle what's called basic life support calls, typically less life-threatening 911 calls. So the MFD paramedics can handle people in the most immediate need. The heads of two private companies, Chris Anderson of Bell Ambulance and Jim Baker of Curtis Ambulance, told the I-Team for years they struggle to offer competitive salaries in the job market for healthcare workers, due in part to how they get paid.
For the last several years, we have actually been losing money on every 911 call that we take for the city, which, as you can imagine, is not something that we are able to do forever.
For a $525 ambulance ride for a Medicaid-insured patient, the state of Wisconsin paid the private ambulance companies $185. This summer, state lawmakers approved a plan to raise the reimbursement rate to $291, which will kick in at the start of 2022.
Even so, it still falls short of what the Medicare rate is, but it's still a drastic improvement.
I wouldn't say it's the fix. I think it helps. It certainly gets us closer to where we need to be to make this sustainable. But I hesitate to say that it's the fix.
One of MFD's proposals would be to offer the private ambulances a sort of subsidy, which will help them stabilize from now until January when the rate increase kicks in. But the problem goes deeper than dollars and cents.
There is an acute shortage of EMS personnel. We're seeing a lot of EMS people that used to work on ambulances such as this are now working in hospitals or urgent care centers.
MFD Assistant Chief Joshua PARISH explains only putting money towards the problem is not the cure to the EMT shortage in Milwaukee.
The key goal here is to not use that conventional method of just pay people more. It's really to say, how do we increase the supply of available people to actually work in these jobs?
He says they could consider hiring healthcare students while they're still in college to give them the skills to use throughout the rest of their careers.
A lot of the items that are core concepts in nursing, that are core concepts in healthcare, when we talk about looking at cultural competency, looking at the social determinants of health, actually looking at cross-cultural communication and high-stress communication. Those are all skills that we practice in EMS on a daily basis.
Other proposals would include recruiting efforts in Milwaukee public schools. For the private ambulance companies that have been on life support themselves, it all has to come together to work.
If it's done correctly and all these pieces come together in the right way, we really believe that's the answer, and will sustain this system going forward.
The private ambulance companies are hoping to have those proposals heard and approved by late September so they can all prepare for Paratech's exit. Reporting in Milwaukee for the I-Team, I'm SHAUN Gallagher.